There are very cliche symptoms of menopause that you can't really blame on anything else. And the classic is the hot flash. So for years, all of the science centered around vasomotor symptoms or hot flash or hot
Can you just
flushes.
talk for a minute, make sure everybody understands what you're talking
So some
about?
countries call it hot flushes. In the US, we call it hot flashes. Basically, this eruption of heat that starts in our core and tends to go up, into our chest and head and neck and then out into the extremities. It's very disrupting. Quite often, it's preceded by a panic attack in some patients. You get this level of anxiety, then you get really hot, then you start sweating. This could be in the middle of a boardroom presentation, in the middle of teaching children, at any point of your life. These hot flushes can cause significant sleep disruption. We know that when you go through the menopause transition, the loss of estrogen accelerates our bone loss. So osteoporosis starts, osteopenia and osteoporosis start to begin to manifest. And then there's genital urinary symptoms, which we have lots of estrogen receptors in our vagina and our bladder. And when we lose estrogen in those areas, we start having dryness, loss of lubrication, and recurrent urinary tract infections. So those are kind of the ones we know. But modern science is teaching us that we have estrogen receptors, estrogen-sensitive tissues all over our body. So another woman's menopause may skip over all of those traditional symptoms, easy to, that clearly must be menopause. And of course, her cycles, right? Cycle disruption, and then they stop, period, stop. But there's neurological symptoms, cognitive disorders, mental health changes, GI, gastrointestinal changes, as you guys know, musculoskeletal issues that pop up. So a lot of women don't realize that their menopause may be manifested by frozen shoulder or tinnitus or vertigo that, came out of nowhere suddenly in this time period clumped around her last menstrual period.